Hi, Dion.
Hello.
My name is Brianna, and I am here to do a peripheral neurovascular exam for you.
Mm-hmm.
Okay, so you just can relax, and I'll just kind of go through it, okay?
Mm-hmm.
Okay, so first I'm inspecting his arms. I'm going to look at his arms from the fingertips to the shoulders. So let's see your fingertips, looking at the color of the nail beds, looking at the skin on his hands, flip them over, looking at the palms, the skin on the palms, also at the skin of the arms on the inside and also on the outside. Then we're going to look at the skin on the arm here and compare it. Okay, so I'm assessing now. Next, I'm going to move on to assessing the side symmetry and underneath swelling. So the size of his arms are normal. I do not see any signs of swelling or edema, and they are symmetrical. The color of the skin is brown with a golden underhue, and the nail beds are pink, and they look normative. Next, I'm inspecting for venous patterns, for any prominent veins. He does have some prominent veins in the uh, anterior portions of the arm, very prominent veins coming down the lateral, like the contour of the arm. Same on this side, and also too in the fold of the elbow. On the outside, um, there aren't any prominent veins on the outside. No prominent veins up on the upper part of the arms, around the shoulders. There are some prominent veins by the wrists, on both wrists, on the hands. Many prominent veins on the hands. Next, we are going to move on to the legs. So if you could lay down for me so I can assess your legs. Okay, so now I'm moving on to assessing his legs. I'm looking for the side symmetry, and I'm noting any signs of swelling. So the size, they are symmetrical. The size is normative. Um, he does have some signs of swelling in both of the legs. He does. I would say that it's relatively mild swelling. I'd rate it as a 3+ or 2+ swelling. The color of the skin, and back to the skin. I'm assessing the skin from the groin to the toes. So I'm gonna get him covered up so that we're not exposing him too much. Okay, so I'm looking at the skin on his groin. Get him covered up. I don't see any lesions or any open sores. All the way down to the toes. Looking at that skin. Down to the toes, underneath the heels. No open sores. No signs of venous no discolorations. The skin is a little dry, but there is no signs of vascular pathology. The nail beds on the toes are pink on both toes. He's a little ticklish. for the distribution of hair on the lower leg, feet, and toes, he has virtually no hair on his legs, no hair on his feet, and like a few hairs on the bottom knuckles of the toes. So he has no hair on his legs. Next, I'm going to inspect the leg for varicosities, any varicose veins. He does not have any varicose veins. Looking at the upper thighs as well. No varicose veins. Next I'm assessing for pigmentation, rashes, scars, and ulcers. He does have some hyperpigmentation on the knees bilaterally. He does have some scars, prominently more on the right leg. The left leg does have a few hyperpigmented scars and some more hyperpigmentation by his feet. More hyperpigmentation on the knuckles, on the first knuckle of all of the toes. There I don't see any rashes or lesions. He does have like these small points of like dark spots all over it. They almost look like hair follicles. But those are like generalized and widespread all over his thighs, and also some on the lower portion of the leg bilaterally, but mostly they're on the thighs. They're very visible, but they're not they're not visible in the groin, just on the thighs. Okay, now can you sit up for me, please? We're going to move back to your arms and palpate your pulses.
Mm-hmm.
So we're going to palpate his pulses. I'm going to palpate his radial and his brachial pulses. I'm going to be sure to palpate them at the same time so that I can see if they are symmetrical. And they're both 2+. Now go like this a little bit. That one you can't do it at two at a time. You gotta do one at a time for that. Or the brachial pulse. Okay, 2+ on this side. We're gonna go on the other side. Palpate that brachial pulse. Oh, there it is, 2+ on that side as well. Next we're going to palpate for the epinocular nodes. So what I'm going to do, we're going to flex that elbow at 90 degrees and palpate 3 centimeters from the medial epicondyle between the biceps and the triceps. Just trying to palpate for that epicondyle nodes. Do the same on the other side. Palpating for the epicondyle nodes. And they are not palpable on him. Alright, next we're going to assess for capillary refill. So let's assess capillary refill on your fingers. Capillary refill is brisk, and all fingers bilaterally, less than 3 seconds. Okay, now what I'm going to have you do, please, is can you please lay back down with your head on the pillow, and I'm going to palpate for the femoral, popliteal, and dorsal pedis and posterior tibial pulses. So first we're going to start with the femoral pulses, trying not to expose the patient too much, especially since this is going to be on YouTube. So I'm just going to keep him covered, but we're just going to palpate the femoral arteries right in the groin area there. Okay, femoral pulses are present, and I just did it right here on him. I can show it on myself because I'm clothed, but he does have pulses in both of his femoral arteries, and they're 2+. Next, we're gonna move on to the popliteal. The popliteal is behind his knees. Bend this knee for me, please, sir. Thank you. Very good. Bend this knee. I'm gonna assess the other one here. Okay, 2+ for the popliteal pulses. Next, we're going to move on to the dorsal pedal pulses. Those are on his feet. You can do these simultaneously. Yep, present both at 2+. They're normal 2+. And then the tibial, the posterior tibial pulses. We're going to find that behind the ankles there. And those are also 2+. Bilaterally equal and even. Okay. Now I'm going to know the temperature of the legs and feet. I'm going to palpate going down, starting at the knees. So starting at probably at the groin. Temperature of the bilateral legs are warm, and there is no decrease in temperature as we palpate down the leg. Then we're going to look for some edema. I'm going to compare sides. He does have mild edema, about a 2+. It is, I'm going to, the edema starts below the knee, at the top of the shin area. And then I'm going to assess whether or not it's pitting or not. So also I'm looking for prominence of bones and tendons in his legs, and no, he does not have that. His edema upon assessment is non-pitting edema. Now I'm going to assess the capillary refill of the toes and the feet bilaterally. Just looking on one foot at a time. He has great capillary refill. The nail beds are nice and pink. Now we're going to look on the actual foot. Great capillary refill on the foot, less than 3 seconds. And there were no signs of abnormality for the cap refill. And that concludes the peripheral neurovascular exam.